or the name?
Once I have all of the names.
Hello, everyone. I'm just going to give just a couple minutes as people are joining because I know I keep seeing names pop up and I want to give everyone just a minute to connect. So I'll join you guys in just a minute. All right. Hello, everyone. How are you guys doing?
Hi.
Good. Thank you for joining. It's always nice to see familiar faces. I also see some new faces and names on here and some people who moved to our other office. So it's nice to get to see you guys. I miss you. Okay, so I'm Dr. Nicole Heatherly, for those of you who may not have met me. I work at Mid-Atlantic. I know we have some non-patients here. We have some people from out in the community. So I'm going to speak to you guys as if you may have no idea what chiropractic is tonight. And the whole talk is not about chiropractic. That's a small portion of it, but the main focus is how to prevent migraine headaches or headaches in general. So before we get started, I want you guys to, if everyone could mute their volume, because when you speak, what it'll do is you'll pop up on everyone's screen. So I am going to ask some questions or for participation. So if you have to answer a question or say something, just unmute and we can chat. The other thing I want you guys to do is the first 10 people who had signed up for this talk, we're giving a little migraine self-care kit. So most people won't know the order in which they signed up. So we'll let you know. But what I will need everyone to do is if you could go to the participants tab, and what you'll see is you'll see Market Square. And if you could just type in your name and your email address, that way we're doing a bit of a roll call. We just want to know that you're here. So I won't be able to manage all that, seeing your name. So if you could just, like I said, for those of you who just popped on, if you go to participants and then find Market Square on there, we just need your name and your email. And that's going to put you in a drawing, but it's also going to let us know that you were here. That way, if you were one of those first 10 that signed up, we can get your migraine kit to you. So I'm going to give everyone just a minute to do that, to go to Market Square. And for those of you who just joined, it looks like everyone actually is muted. And also, actually, one other thing with that, if any of you invited any guests, or if you have a guest on the screen with you, you guys are going to get drawn or entered into a raffle to win a Hypervolt. So anyone who has a guest or invited a guest that is here, if I see a message from you, Lee, so you're good. You sent it to me, but that's okay. I see it, so I'll note you down.
Thank you.
And so yeah, so anyone who has a guest, like I said, type your guest's name and your email address to Market Square. And that way, before I actually end this call, at the end of the call, so you got to stay to the end. At the end of the call, I'm going to draw this. So if literally only one person on here has that guest, you might be the winner. So make sure you get your guest name and your email address sent to Market Square, because we're gonna draw the name at the end. And okay, so I'm gonna get started here. Okay, so I'll start with my face, not my PowerPoint. I'm going to be switching back and forth. Sometimes I'm a little technology illiterate. So hi, Patty. Good to see you. So bear with me if I'm a little slow with switching back and forth. But for those of you who just joined who don't know me, like I said a few minutes ago, I'm Dr. Nicole Heatherly. I'm one of the 3 chiropractors at Mid-Atlantic. I'm in our South location. And now we have a North location. So that's awesome. Tonight's talk is about migraine headaches. And the reason why I wanted to do this talk, I specifically asked to do this talk because I have suffered from migraine headaches. So I, of all people, know how horrible, how debilitating they are, and how much better your life can be if you get rid of them. So I wanted to share that with you guys today. So how many of you, actually, before I get started, I wanted to mention this to you guys too, because it'll make me feel more comfortable. They say there are 3 times where you feel alone in life. And the first one's when you're born. The second time is when you're dying. And the third is when you are sitting up in front of a group of distinguished people like yourselves presenting. So with that said, go easy on me, participate with me. If I ask a question, unmute and answer, or smile and nod. If I tell a joke, maybe if it's not funny, still laugh, but just participate with me. So tonight will be fun. So with that said, in terms of migraines, how many of you have ever had a migraine? You can just raise your hand because I can see all of you guys. So a lot of people on here, and I know from just seeing patients, a lot of people suffer from migraines. So someone tell me what a migraine feels like. Someone can just go ahead and unmute themselves, and what kind of things go along with a migraine? What do you feel? Because some people have never had a migraine. Some people have only had a headache. And if you have had a migraine, it does not even compare to a headache. So what's a migraine feel like? I think you were talking, Patty. I saw you, but I didn't see you unmute yourself.
I have never had a migraine. I'm sitting in on behalf of my daughter.
Okay. Okay. Sorry, I thought I saw your mouth moving. Well, yeah. I'll fill in because I can tell you guys what a migraine feels like. Okay. It does not feel good. It is nothing like a headache. A migraine it feels like a pulsating pain in your head. It feels like your head could explode. And a lot of times you're also sensitive to light. You're sensitive to noise. So what that means is it's difficult to be out and about in the light. It's difficult to hear yourself even talk because it increases the pressure in your head. A lot of times it's on one side, but it doesn't have to be. Sometimes it has something called an aura that goes along with it. And what an aura is, and I see Summer, I see you like, yeah, you know what it is. And an aura almost looks like spots in your vision, like floaters, and it can make you think you have something seriously wrong. Some people have been in and they're like, am I having a stroke, Dr. Nicole? What's wrong? So it's a really scary thing. When I get migraine headaches, when I have gotten them in the past, it will make me vomit. So a lot of people have, and I see you shaking your head, Carla.
I do. Yeah.
Because our body, there's so much pressure and we just need to get rid of that pressure. So our body literally forces us to vomit to decrease that pressure. So for those of you who have not gotten one, Patty, feel blessed that you have not gotten it because it truly is debilitating. And to go into a bit of my story and why I'm doing this, like I told you guys, I used to have migraine headaches in high school, and they were horrible. They were debilitating. And, my parents had taken me to the doctors. I went to the neurologist. I went to a medical doctor. A medical doctor would say, oh, you just have headaches, it's fine. But when they get really bad, then they'll refer you. So I was referred to a neurologist who poked and prodded and did sensory tests on my face and did all kinds of things. He referred me to an MRI. If any of you have had a brain MRI, I know some of you probably have. And it's horrific. They put literally a cage around your head, stuff you in the MRI machine. So I had to get that. So imagine an MRI with a cage around your head, holding still. They pulled me out, injected me with dye while I had to hold still with the cage around my head, go back in. So my point is I went through so many tests to get to the solution, their solution, or their diagnosis of migraine headaches, which I already knew I had migraine headaches, right? So that was their diagnosis. And the treatment, which is the common treatment for migraine headaches, is to prescribe a drug. I know some of you have been prescribed those drugs. And oftentimes, when I meet someone who's on a migraine medication, I say, hey, how's it working out for you? Because you're in here on my table with a migraine. Is the migraine medication working out? And oftentimes it's not working. And I'm going to go a bit into why it may not be working. And for some people, it may work. And if it does, that's great. That's awesome. However, we still don't want to have to rely on a drug to feel good, right? We want our bodies to be so healthy, so great that we don't need to rely on drugs or surgery or any other intervention. So to go back to that story, you know, I was poked and prodded and they said, you have migraine headaches, take these drugs. They prescribed me 2 drugs. One drug, Topamax, for any of you migraine sufferers, you may have heard that. And that drug is something you take every day to prevent a migraine. So then they say, here's this other one, here's Imitrex. And you take Imitrex because when you get a migraine, you won't need to take this one. So that right there should tell that something doesn't add up, right? Take this drug to prevent them. But if you do get one, if this drug doesn't work, take this other drug to take it away. And that second drug, actually, I think I was allergic to it. I ended up having to take it, Imitrex, and it made my throat swell up. So I never took it again. So that was my solution. You know, I did take the medication, but it didn't work. But I took it because that's the only solution I was given. And a lot of my patients, that's the solution they're given, to take a drug, and they're on it for possibly the rest of their life. So I don't want that to be you guys, which is why I want to share this tonight. So long story short, I'll speed this story up a little bit. I took the drugs. I got to college. I got to the point where I was still having migraine headaches. So I'd go to classes all day, go to work at the chiropractic office that I worked at in undergrad. And then I'd come home, I'd go to my freezer, get my ice pack, not even say hi to my roommate, go plop the ice pack on my neck, go take a hot shower, turn the bathroom lights off. And that was a cycle because it was debilitating. I couldn't do anything else. So like I said, I worked at a chiropractic office. I worked at the front desk at an office in undergrad. And that chiropractor took x-rays of me, examined me, and found misalignments in my neck. So he adjusted me. I was put on a schedule. I started getting adjusted. And I'm not kidding you, the first adjustment, I got up, literally felt like a weight was lifted off my shoulders. I went home that night to my roommate and she's like, wow, you didn't go get your ice pack tonight. And I'm like, that's because I'm feeling great. So I want that to be you guys too, for those of you who have not been checked from a chiropractor, but maybe some of you have. And maybe you still get migraines, because chiropractic is not the end all be all, and it's not the answer for everything. It's not the cause of every single migraine. So we're going to go into a lot of that tonight. So that's why I want to share this message with you guys, because I don't want you to be one of those people who have to rely on drugs. So with that said, I'm going to pull up this presentation. Okay. So can you guys see that screen? Can you see the PowerPoint? Okay. So what is a migraine exactly? Because it's different than a normal headache. A migraine can be defined as intense throbbing or pulsating pain, typically in one area of your head. The reason why it has that pulsating pain is because it's actually due to constriction of blood vessels, meaning the blood vessels are getting smaller. So the blood is kind of putting pressure on those blood vessels. So that's where that pulsating pain is coming from. Like I said earlier, it's usually on one side of the head, doesn't have to be though. And it usually has, or sometimes can have an aura. The other thing with migraines is, and I didn't know this until the first time I did this presentation a couple of years ago, is that migraine headaches are actually the third leading dis-ease, if you want to call it a dis-ease or disorder or ailment in the world. The only two things ahead of that are tension headaches and dental cavities. So that shows you how many people have migraines and have headaches in general. And most people have headaches so often that when they come in here and I ask about headaches, they say, yeah, just the normal headache. When there's no such thing as a normal headache. We should not be getting headaches ever. So yeah, they're very prevalent. Kids can get them. They can start in childhood. And they are most prevalent in women. Maybe that's why I see a lot of women on my screen here joining this presentation, but they are more common in women, typically in the 30s or 40s. But these are just stats. They can be anyone can suffer from a migraine. Is the main point. So the common treatment for migraine medications, which was the treatment I was given, if you go to a medical doctor, you say, I have migraine headaches, or I have headaches, they'll ask you some questions and they'll most likely prescribe you a drug. Now, if you see here, most migraine drugs tend to work 50% of the time in 50% of people. 50% of the time in 50% of people. Those are very small odds. And that's why I see a lot of people coming into my office who have not benefited from migraine medication. So the other thing with medication that I want you guys to know, and this is not just with migraine medication, this goes for all medications, is that there is a bit of a placebo effect. Harvard Medical School did a study, and it showed that your expectations for a drug, about a drug, are actually just as important as the drug itself. Meaning, if I give you a drug and I say, Patty, this drug is going to help you with your migraine headaches, and then I give you a drug and I just say, take this drug, it will be more effective if I put that positive statement with it. If I tell you it will help you with your migraine headaches, okay? And that's what we call placebo effect. So again, it applies to all drugs. If you just me telling you that it will be effective and that it will work for that will increase the odds that it will work. It's an actual study. So there's a migraine drug called Maxalt, and they did this study on them at the therapeutic placebo studies, the program and placebo studies and therapeutic encounter at Harvard Medicine. They did this study on Maxalt, the migraine medication, and it showed that when they were given the drug and they were told it was effective for migraines, it increased the outcome of it. So, and they've done it the reverse way too with the placebo, meaning the placebo was effective in treating the drug. So the main point I want to make with this is that the drugs are only working 50% of the time in 50% of people, but we may argue that the times that they do work, that 25% of the time that it does work, it could be due to the fact that they were told it would work in terms of the placebo effect. So the other thing actually I want to mention with this drug, Maxalt, in case anyone is on it, the type of drug it is, tryptamine, essentially, it's a tryptamine-based drug. What they do is they constrict blood vessels. So if we have a migraine headache and our blood vessels are already constricted, it's probably not a good thing to take that and constrict them more, correct? One would think that. And that's true. So we don't want to be taking that in the first place. So to break tonight down, because like I said, it's not just about chiropractic. I'm going to mention it, but I'm going to mention the main point of this is to give you guys a bunch of other tools of what to do at home, because a lot of you are already patients and have been checked. So to break it down for you guys, I'm going to go into 3 components of health. And this is really how you guys can look at any ailment in your body. Any ailment in your body, you can look at these 3 realms of your life: physical, chemical, and emotional. So physical, it would be our actual physical alignment, like what we check on you guys when you come into our office. So, it would be your posture. It would be how you stand, how you sleep, your working posture. It would be all of that, any repetitive activities you do, just physically, what is our body doing, the exercise that we get. So that's the physical realm that we're going to talk about tonight. Chemical means physiologically, on a chemical basis, what is going on in our body. So what things are we ingesting food-wise? What products are we putting onto our body? What are we spraying around our body? What are we inhaling through our environment? What supplements are we taking? What drugs are we taking? Because all of that, what are hormone levels? Do we have any toxicities? Do we have any mineral deficiencies? Those are all things that we need to look at, because it's not always just one thing. So we need to approach it from all realms. And lastly, we have emotional. So that is our thoughts. That's our stress levels, because how you're thinking can manifest physically in your body. I have so many patients who come in and their problem spot is flared up. And the thing that's going on in their life is increased stress. Stress can make a problem manifest itself. So it's not that the stress is literally causing the problem, but it can make it express itself. So we want to see, are we getting enough sleep? Are we under prolonged stress? So we're going to dig into each one of these throughout this presentation. So to start out, this kind of goes along with the physical component, because we need to know what are alignments like, what's controlling that. So this is the nervous system up on the screen. And for those of you who are patients, you know this is what we deal with as chiropractors. For those of you who aren't, surprise, this is what we work with. We deal with the control center of your body. So this system regulates literally every function in your body. It regulates your heart beating, it regulates your digestive tract, your reproductive organs, your ears, your eyes, everything you can feel, everything you can't feel. And I'm not going to bore you with the nitty gritty of this, but just know you have different parts of the nervous system. And you have this one part called the autonomic nervous system. And that's the part you can't feel. So you're not going to have pain there if there's a problem there. So the autonomic nervous system is what controls those blood vessels. Remember, we talked about migraines are due to constriction of blood vessels. So the autonomic nervous system is what controls that, okay? And we deal with the nervous system, okay? So that's how indirectly chiropractic can help headaches. And like I said, it helped me. Again, this is not the answer for everyone. Everyone's migraine headache is not caused by something in their spine. So, well, actually, before I move on, for those of you who are wondering, well, how could a misalignment cause a headache? I have a little spine model here real quick. So just know, this is your spine. Inside of it's your spinal column. You have these little nerves branching out. So what can happen, and we'll dig into this in a bit, is the bone can go out of alignment. And when the bone goes out of alignment, it's going to interfere with that nerve. So if that nerve is controlling blood vessels, controlling autonomic function, then it will be interfered with. It could tell the blood vessels to dilate too much or constrict too much, either or. And then it could cause that migraine headache. So what I do as a chiropractor is I find these misalignments. When someone comes into my office, what I do is well, not just me, all of us doctors will do a consultation to get an idea of what's going on. But then we'll do an exam, and then we'll do some scans, and those scans test the nerves. They actually narrow down where there's a problem with the nerve. And finally, we do x-rays because I need to see what these bones are doing. I need to see if there's anything twisted out of place interfering with that nerve. So if there is, we use our hands. We do an adjustment to restore that nerve function. So there is an actual statistic. Over 70% of all headaches arise from problems with the cervical spine and its related structures. Again, it's 70%. It's a large number, but that's not everyone. So I don't want everyone on here to think if they've had a migraine, it's because of a misalignment, but it's a big percentage. So typically it's these top two bones in the neck. The atlas and axis. A lot of you have seen this. We take this view at our office. We actually compare at our office the relationship to those bones. And that's because they're so important. A misalignment with those bones can not only cause a migraine headache, but it's actually pinching off the brainstem. So I have some patients who have seizures with that. I have some patients who've had entire one side of their face, they'll come in with the face drooping. And after an adjustment, it's completely normal. I have some kids with ADD. I have people with anxiety, people with depression. So this is a super important area. There are some chiropractors who only adjust these two bones, or even more so, but only adjust the top bone, the atlas. So it's very, very, very important that we check this. And this is a cervical curve. I'm just showing you guys some misalignments just to give you an idea of how chiropractic can help before I get into the main things or the other things. But this is a side view of someone's neck. So the one to the left is not a good x-ray. Okay. Some of you have seen your own x-ray. It's looked like this. So it's a side view. You can see the skull. Can you guys see my mouse? Okay. So you see the skull here, and this top bone, these top two bones are the two bones that we were just looking at. So those can be misaligned, but besides that, look at this curve right here. So see how straight that is? And then when we go to the one in the middle, this is after the patient starts getting adjusted. And now you can see how it's a little more straight up. Their head's less forward. If you guys look at my screener, can you see me too? Okay. So we've all seen these people, I know, that are way out here, and that is what happens. That's the progression. I'm actually going to show you this. Let's see. Okay, so now you guys can see me again. Okay, pretend this is my head, okay, or pretend it's so it's like 10 pounds, pretend I have a bowling ball. Imagine this is my neck from the side. If I have a proper curve, which is what it should be, okay, or imagine this is that curve in my neck, the x-ray that you saw to the right, that's going to support my head, okay? So what happens when we get misalignments in our neck is our neck actually starts to straighten out. So first it goes straight. So now imagine the pressure of all of that force weighing down on all of these nerves in my neck. Okay, so now it's straight. So now if I curve even more, and a lot of people I see this spine, their neck is literally curved the opposite way. Have you guys seen those people that are their neck is way out here? So imagine that if I held a bowling ball like that, that's going to strain my wrist, right? So a lot of us are walking around with straight necks, or even worse, reverse. I know some of you on here have a reverse curve, and it's trying to hold your 10 plus pound head up. So that's a lot of pressure on those nerves. So we've got to check for those misalignments. Now, I know a lot of you on here are already patients. And so that's great. Congratulations. That's awesome. But some of you are not a patient here. So for those of you who are not a patient here, I wanted to offer you a gift. Haven't done this since the last time I did this talk, which was, like I said, over 2 years ago. And we don't do this often, but I'm so passionate about it. And anyone suffering, I want them to get help. So what we do when someone comes into our office, those of you who are patients, you know, we do a full consultation, a full exam, we do a full set of x-rays, and we do a full set of neurological scans. And those things help us find where the misalignments are that could be causing a symptom in your body, i.e. a migraine headache or any symptom. So as a thank you guys for joining me tonight as a part of this presentation, I wanted to extend you a gift. And that gift is a chance to come into our office and have all of that completely on us, completely complimentary. So no strings attached, no obligations. If you show up once and get your x-rays and never come again, fine. But at least you'll know whether or not it's possibly a misalignment causing the problem. Okay, so I just wanted to put that out there and offer that to anyone. Also, just so you guys know, because I know some people may have to jump off early. I know some people are going to come late. So for anyone who has someone, because a few people asked me, they said, Dr. Nicole, I have a guest, but they can't come, or whatever it is. If you have someone special in your life who's truly serious about wanting to get checked, or you want them to get checked to see if chiropractic could be the answer for them, then tell them about this talk and send to Market Square. If you go to participants, send to Market Square their name and email, or if you don't know it, send your name and email. And what we'll do is we'll send them a recording of this talk. And if they listen to this talk, that will enable them to get the same thing. Everything, x-rays, scans, everything completely complimentary. That's our gift, because we want to truly help people. We want to see if we can help with any symptom. So let's get back into the presentation here. I'll pull this up. Told you guys I'm slow at sharing my screen. I'm sorry. Okay. So to talk about, one thing I told you about misalignment. So you guys are probably wondering, well, how do I just get misalignments? Am I born with them? Do they just pop up? How do I keep getting them? And so this really applies to you guys too, who are already getting adjusted, because these are things you can look for at home to try to figure out how you can stop getting the misalignment. So the first thing is, get checked, see if you have any in the first place. But if you've already been checked, then these are some other things we need to address, because we want to make sure you're not getting adjusted and we're not putting it back in place, and then it's coming right back out. So these are some of the things that can cause misalignment. Starting out, the birthing process. That goes for mom and baby. Oftentimes, the baby is kind of in a different position, or they're in a small space, and that can lead to misalignments. The birthing process alone can lead to misalignments. Did you guys know that when a baby, it comes out of the canal, and this is just a normal vaginal birth, there is 6 to 16 pounds of pressure on their neck. Imagine that little baby's head and 6 to 16 pounds of pressure. Okay. Now, imagine if a vacuum or forceps were used. And I'm not just throwing out numbers. This is real scientific data. If vacuums or forceps were used, there is up to 140 pounds, okay, on their spine. And it sounds crazy. There are structures holding in place, which is why the head doesn't pop off, but there's that much force. And so oftentimes I see babies, my youngest patient has been 2 hours old, and they have a misalignment. So a lot of people are like, no, babies are perfect. How could they have misalignments? All the time they have misalignments. And then what happens if you leave it? It's going to deteriorate as an adult and turn into what we see on a lot of spines, degenerative disc disease. So you want to get babies checked. But besides babies, moms, their bodies are going through so many changes. I know we've had a few patients here who've received care while they've been pregnant. Carla, I see you raising your hand. Just out of curiosity, did you feel better when you were adjusted through your pregnancy versus the pregnancy not being adjusted?
It was like night and day difference.
Okay.
Yeah.
Awesome. And
during my first pregnancy, I was not even able to walk the last month of the pregnancy at all. Like, I was completely bedridden. And yes, I was bedridden because the doctors told me I had to be because I had preeclampsia, but I was also bedridden because I physically could not walk because of the sciatic nerve pain.
yeah.
So, and I was walking and I was working the whole pregnancy this past time, and
Wow.
I was being adjusted every week.
That's awesome. That's awesome.
Yeah. And I was going to add something. Can I add something really quick?
Sure.
Because you were talking about the vaginal births. So I had a C-section with my first baby and a VBAC with my second. And I had the VBAC 3 months ago. My baby's 3 months old today. So, and I had both babies get adjusted and examined by you guys just within the last month or two.
Yeah.
And the one that had a C-section, I mean, she's 3 now, but she had more issues than my more recent baby. So that's to say too, that like, even with a C-section, I had no idea that babies could get misaligned with a C-section. It seems like just pull the baby straight out, but you don't always know what they're going to pull, what they'll like reach for first, if that makes sense. I know that sounds weird.
No, that's exactly.
But that's one thing I learned just in the last couple of weeks from you guys. I was like, what in the world?
Yeah, thank you for bringing that up, because C-sections are actually more pulling on the baby, because you have to get it, and you may have, I mean, I know you're numb, but I don't know if you could feel the force. A lot of moms talk about like you could feel at least the pressure of something being pulled from you.
Right.
So there's even more force on that baby's spine and the mom's spine. So yeah, for mom and baby, during the pregnancy, after the pregnancy, during labor, misalignments can happen. So thank you, Carla, for sharing. The next thing that can cause misalignments is self-adjusting. And I put self-adjusting in quotes because it's not really an adjustment. An adjustment is specific to your spine. We look at x-rays, we look at scans to be able to tell where we need to move that bone and which bone we need to move. I see a lot of people, and I have to educate a lot of patients on why we don't want them. You oftentimes see people bending their head to the side or twisting their spine, and it feels great because it stimulates these little things in your joints called mechanoreceptors that block pain signals. So that's why it temporarily feels great, but the pain always comes back, right? For those of you who've cracked your own neck before. So the pain will always come back. And what you're also doing, you're making your ligaments lax. Your ligaments are the things that hold the bones together. So every time you crack your own neck or back, you could be causing a misalignment, inducing that migraine headache, but you could also be making your ligaments like a stretched rubber band. Okay. Then what's going to happen is bones won't stay in place. And even if you do get adjusted, it's going to come back out of place very quickly. So make sure you're not cracking your own neck or back. I actually at sleepovers, funny story, when I was younger, used to have my friends lay on the floor and I would crack their back for them. And I should not have been doing that. But now to this day, they're like, you were meant to be a chiropractor. So here I am. But this time I use x-rays. So don't crack your own back. And lastly, this is the biggest category, macro trauma or micro trauma. Macro trauma is pretty simple. All that means are, big traumas, car accidents, a slip and fall down the stairs, kids falling on their butt all the time, something big. Micro trauma is where we can really all assess what we're doing. So micro trauma would be how we sleep, how we stand, how we do all these things because it's done over and over again. So an example of micro trauma would be sleeping on my stomach. Because every night, if I sleep on my stomach, I'm turning my head one way. And that's going to induce rotation in my neck. And remember, we talked about a lot of misalignments in the neck will cause those migraine headaches, specifically C2, that second bone. So if you're holding your head like that all night, it's not going to be conducive to proper alignment. Working, you guys want to look at your work posture. A lot of times I see, we're hunched forward, we're looking down. I actually forgot to stack my laptop on books, so I'm actually probably going to have a lot of tension here, but we really, really want our computer to be eye level. A lot of people will be turning one way over and over again, and I'll literally see it on x-rays. These repetitive patterns that we do over and over and over again cause misalignments in their spine. Dr. Amir and I both actually caused a curve in our own spines from standing on the same side of the table over and over again when we adjust you guys. So we have to start mixing up those activities. So the main thing you want to focus on is don't do the same activities the same way over and over and over again. If I always carry my purse on this shoulder, eventually this is going to cause a misalignment. If when I talk on the phone, I'm going like this, eventually it's going to cause a misalignment. Sleeping. So I think you guys get the point. Look at all of the activities that you do in your, even baby holding. So for you, Carla, with a new baby, you don't always want to hold her on the same side because that's not only going to cause misalignments in you, but also her. So the main thing you want to focus on is what am I doing over and over again? And how can I mix it up? How can I do it a different way? Pay attention to your work posture. Make sure you're not stomach sleeping. And then a few things you guys can do at home regarding sleeping too. We made a video online. A lot of you have already seen it, but if you haven't seen it, it's on our YouTube channel, Real Chiropractic, and it's a pillow video. It's how to use your pillow. And we basically describe how you lay on your pillow because as simple as it sounds, a lot of people don't sleep on their pillow correctly. So their neck isn't supported, causing misalignments. So environmentally. So now we're kind of shifting into the biochemical component. Because remember I said everything around you, everything you put onto or into your body, all of these things can cause misalignments. So what you want to pay attention to is your air quality. So if you're burning candles in your home or you're spraying Lysol or all of these chemical cleaners are actually toxic. I know they sell them in the stores, but just know they are not good for us. And when you're inhaling them, it's going to have a change physiologically in your body. So you got to watch what you're using. I use all natural products, everything, cosmetics, candles, everything, literally everything. So look out for your products because those alone chemically could be inducing migraine headaches or any symptom in your body. Weather changes, when the barometric pressure increases, when it's raining, it could cause a headache. So you can't do anything about the weather. But just know that may induce a headache. Blue light, that's a newer thing. We were all hearing about, I forgot my blue light blockers. I meant to bring them back here to show you guys. But basically you can get blue light lenses built into your glasses, or you can order blue light blocking glasses. But what blue light does is it comes from all of this artificial light. You know, we need it during the day because it keeps us awake. It controls the our sleep cycles. But what it does when we're exposed to it, especially if we're, you know, the main way to be exposed is through computer screens and cell phones. So if you're constantly being exposed to blue light, that will have an effect on your body, not only on your eyes, but on your sleep cycle. You know, oftentimes, I'm sure some of you have seen this where maybe you are you know, up late and you're on your phone or computer or whatever, and then you have a hard time getting to sleep. It's most likely due to the blue light. You can also, just so you guys know, set your phone. What I do at 8 p.m., I have a timer for 8 p.m. My computer and my phone have a night light that comes on, and you can actually have like a blue light screen come on your phone so that you don't need to wear the glasses. The phone's already set up that way. So now I'm going to talk about some deficiencies, vitamins, supplements. A big cause of migraine headaches, actually 42% of migraine sufferers actually had a vitamin D deficiency. So that's a huge number. So the true way to tell if you have a deficiency is to get checked, get a blood test, get your numbers checked. But other symptoms of vitamin D deficiency could be depression. So if you're depressed and you have migraine headaches, it could be likely that you do have a deficiency. Optimal levels of vitamin D are 50 to 60. And if you do want to supplement with vitamin D, you know, you can take around 5,000 IUIs. If it's a kid, you know, 10 to teenage years, they can do half of that. But they're truly, truly, truly the best way to get vitamin D is through sun exposure. And what your goal should be is about 20 minutes a day. Now, that's 20 minutes of fully unexposed skin. Most of us are not walking out fully unexposed with no clothes on. So with that said, you probably want to double it. And, you know, there's this big, a lot of people say, you know, you don't want to be in the sun exposure is bad. Sun exposure is not bad. If you let yourself burn, that's bad. If the cells are damaged, that's bad. So small amounts of sun exposure are actually very necessary, because what our body does when we're exposed to sun, it converts cholesterol into vitamin D. It converts something on our skin into vitamin D. So the other mistake that people make is they go outside and they get sun exposure and then they come right in and they shower, but you're actually washing all that off. So if you can, ideally you would give it 24 hours. Most people don't want to wait to shower. So at least give it an hour. You know, if you go out to you're out in the sun, give it an hour before you shower. That way you don't wash all that off, because you're defeating the purpose. So like I said, best way is sun. Oh, last thing with sun, between the hours of 10 and 2 are the best. And that's because there are two different types of rays. We have UVB rays, which are good for us, and UVA, those are the bad rays. So if you want to get UVB, between 10 and 2 is when you want to focus on going out. And if anyone wants this PowerPoint, by the way, after the fact, for any of this information, you're welcome to message us and we can get it to you. We can get the recording to you or whatever you'd like. So the next thing is CoQ10. Another name for this is ubiquinone. So this is something that is in our body. And essentially what it does is it helps with the function of these things in our body called mitochondria, which basically just know that they're for healing and regeneration in our body. So we need this to heal, for anything to heal in our body. And a lot of things in our environment, pollution, will decrease coenzyme Q10. Well, migraine sufferers have been known to have decreased levels of CoQ10. So that's why I'm adding this in there. You may want to supplement with it and see if it helps. Keep in mind, guys, out of all of the things that I'm saying to do, all of these extra things, supplement with vitamin D, get enough sleep, make sure you're doing this right. All of those are completely useless, or more useless, I should say, if we have alignments, because you could do misalignments. You could do everything right. You could eat the perfect diet. You could get your sun exposure, have all of your levels correct. But if you have a misalignment, if you have bones out of place that's interfering with those nerves, you know, we need to correct the misalignment. So just a reminder to anyone who may have not been in the beginning when I offered the gift, what we're offering to anyone who wants to come in, who's not a patient yet, a chance to come in with no strings attached, completely complimentary. We'll give you a consultation, an exam, full set of x-rays, full set of scans, and pretty much see if we can help you with anything in your body. So just if you want to take advantage of that, all you have to do is message Market Square under participants and type in your name and email and type in new patient or requesting new patient visit so that they know that that's the meaning behind that. But yes, CoQ10, you can get, the best way to get supplements is through your diet. So before you go out and buy all these supplements, try to focus on getting through your diet. So I have a list here off to the side of things that are high in CoQ10. I forgot to tell you guys foods that are high in vitamin D, but things like egg yolks, things like mushrooms, cod liver oil is high in vitamin D, and salmon. Those are just a few things, but these are things you can look up to online. Magnesium deficiency is a huge one because, and this is a huge one for migraines and for just normal headaches because it creates a lot of tension. For those of you who have all this tension up here and in your neck, try magnesium to help relax those muscles. You can take a magnesium supplement. They do magnesium sprays. You can do an Epsom salt bath, many forms of magnesium. Here's a list up on the screen of some foods that are high in magnesium-rich foods that you can add to your diet. Because like I said, the best source of all of these vitamins and minerals is from food. And keep in mind, when a patient comes here, we don't only focus on chiropractic because we want to assess we want to give supplement recommendations to our patients. We give exercises, we give advice on posture and all of those things. So when someone comes to us, keep in mind, we are looking at all of these things. Female hormones, this is a big one. A lot of patients come to me and they will have a headache right before their menstrual cycle or near their menstrual cycle. And oftentimes it's actually stemming from a misalignment in the low back. But the other thing that can happen is as we go through the menstrual cycle, levels of different things raise and they lower. And right before we actually start menstruating, estrogen levels drop really low right before then. And when estrogen levels drop, serotonin levels actually drop. And serotonin is like the happy hormone. So that's why also a lot of times before a menstrual cycle, you can get really sad. You can be in a kind of a depressed mood because the hormones are all over the place. Well, serotonin also does something else other than controls mood. It controls blood vessel tone. And remember, we said migraines are caused by constriction of blood vessels. So if we're messing around with serotonin levels, that could change the blood vessel tone. So a couple things you can do to help make sure your hormones are balanced. Chase Tree is a supplement I've taken before. I really, really like it for women with any kind of PMS issues, maybe a regular menstrual cycle, but also migraines that may be stemming from hormones. This can help balance hormones. Another thing is Cruciferous Complete helps balance estrogen levels, which is huge for us nowadays. I want you guys, if you're interested, Google endocrine disruptors. Endocrine disruptors are in our environment. They're in everything. They're in plastics. They're in products. They're in everything. And what they do is they alter hormone levels. So right now, I have so many patients going through menopause who are literally going crazy, and a medical doctor is putting all these people on HRT therapy. So yeah, and it's all stemming from hormone disruptors in our environment in all the products we use nowadays. So that's why I really want to shift you guys to natural products if you're willing to make that shift. But another thing you can do to help balance serotonin levels are this supplement called 5-HTP. Now, you don't have to write down this specific brand because I have not used this brand. I just wanted an example of it. With any supplements, I'm not promoting any brand. I want you guys to use, if you have a favorite supplement company, look up and see if they have some of these things that I'm listing off. But the main thing with supplements, you really don't want to get them at Target or Walmart or somewhere like that. You want a good quality tested supplement. Truly, you get what you pay for. So diet. So specifically with diet, again, I'm not going to promote any one thing, and the same thing that works for me doesn't work for everyone. So these are just the things that have been known to help with migraine headaches. So specifically the ketogenic diet. And the reason why is because it helps block this thing called glutamate, which is a chemical. And migraine headache sufferers have been known to have increased glutamate levels. So that's how indirectly the ketogenic diet can help. And I'm not going to dive into what the ketogenic diet is. We don't have enough time to talk about details. But what happens with that is it's a high fat, low carb diet, and you start to burn fat for fuel. And when you do that, you produce ketones, and ketones block the glutamate. Okay. Other things that can affect, and again, it's not the same for everyone, but a lot of things high in histamine. So if you Google high histamine foods, they can cause migraines. But besides that, a common one nowadays is wheat and dairy. You know, the proteins in dairy, casein protein, our body sees it as a foreign invader, and it actually tries to attack it, and it increases inflammation, and in turn constricting those blood vessels. And then gluten is the same way. You know, it's the protein in wheat, so our body wants to attack it. So just pay attention to your diet, and you know, you can look up how to do an elimination diet. And an elimination diet is the true way to see how foods physically affect you, because you'll find, you know, when I did an elimination diet, I did not think I had a gluten allergy, and then I did it, and then I added gluten back in, and now I get these little dots on my face, not pimples, literally red dots all over my face, under my eyes, if I eat gluten. So you'll see that you will have symptoms when adding things back in. So water intake, we all know this, but we all need a reminder, myself included. Dehydration alone can cause those blood vessels to constrict and that pulsing pain. So a general rule of thumb for how much water you guys want to be getting is half of your body weight in ounces. So most people aren't even getting half the amount of water that they should be. So guys, truly make sure you're getting enough water. Stress. You know, there's a lot of us, most of us have gone through school, right? And some of us have gone through college or had a lot of stress with our job, but a little stress is good. Okay. We need that to grow. We need that to stretch our abilities in life. But you need breaks in between that stress. What happens is with chronic stress, where you don't have self-care in between, or you don't have breaks in between, there's a letdown effect. So what happens during the stress, and an example would be, let's say during my board exams, you know, I'm studying, staying up late, I'm highly stressed. And then what happens, my cortisol levels are rising to help me deal with the stress. And then when I'm done with that, what happens is there's a letdown effect, and the cortisol levels drastically drop. And when cortisol levels build up and then drastically drop, that in and of itself can induce a migraine, or someone can get sick. Have any of you ever, studied really hard for a test, or had this big event coming up, or big talk or whatever, and you're like working really hard, stressed out, and you do it, and then afterwards you get sick, and you're like, it's over. Why am I sick now? Well, that's because of that letdown effect. I see it all the time. So Dr. Amir, anyone who's a patient here, you guys all know him. He's the other doctor here. He's the owner of the practice. He wrote a book called The Stress Proof Life. If you guys haven't read it, check it out. If you don't have it and want it, message us and we'll get a copy to you. It'll be our gift to you, but it's not how to get rid of stress, because that you'd have to live in a bubble, move away and live by yourself. You're not going to get rid of stress. That's not reality. But we need to know how to manage stress. And that's what he goes into a lot of this book. How can you manage stress? How can you prepare your body so that you can handle it? So sleep. Sleep is a huge one. We all downplay sleep, but this is the chart of how much sleep we're supposed to be getting. Also, by the way, if you're getting less than 8 hours of sleep, you're putting yourself at risk for Alzheimer's and dementia. It's been studied, it's been shown, so you gotta get sleep, and not 2 hours here, 1 hour there, wake up at 4, go back to sleep for a few hours. You need sleep, because there are sleep cycles. You got to get in REM, you have to go in deep sleep, you need those cycles. So a lot of you are in this category, adults 18 to 64, you should be getting 7 to 9 hours. And I know most of you are not. So if you're not getting that sleep, especially with babies, I see you shaking your head, Carla. And you know, with kids, I get it. It's not an ideal world. You do what you got to do, but that's just temporary, you know. When kids are not the reason, make sure you're getting sleep. And if you can't sleep, if you're having trouble sleeping because of pain or for whatever reason, come get checked or come tell us. You know, for those of you who are patients, tell us. Say, I can't sleep. And we'll help you figure out why you can't sleep. We'll say, is it a deficiency issue? Do we need to add another mineral? Do we need to get you out of pain? Is it your hip pain that's causing? We need to figure out what it is. Is it something you're eating? Are you up too late on electronics? There are so many reasons why people can't sleep. So first, try to get the amount of sleep. If you can't sleep, then let us know and we'll help you out with that. So breath is a huge one. We prescribe a lot of you breathing exercises, and it's for a reason. It controls autonomic tone. It controls, essentially helps regulate the nervous system. Breath work oftentimes induces parasympathetic mode. When we're in parasympathetic, that's just a portion of our nervous system where our body heals. So here's a ratio up on the screen of what you can do. You can take 10 of these breaths in the morning and 10 in the evening. So it's a ratio of inhaling, holding, and then exhaling. So you would inhale for 7 seconds, hold for 28 seconds, and exhale for 14 seconds. So it's a 1:4:2 ratio. We walk you through the breath. We have on our YouTube channel, Real Chiropractic, we walk you through that breath work if you guys wanted to watch the video and learn how to do it. But do those every day, 10 in the morning, 10 in the evening. It's going to help you regulate your nervous system, manage stress, and just relax a little, get you into parasympathetic mode. Meditation is something that has completely changed my life. And all it does is it provides increased awareness and mindfulness. So what I used to do was, when I noticed I wasn't being mindful, I would literally drive from one place to another. How many of you have done this? You drive from one place to another, you get to that destination and you're like, holy crap, I don't remember driving here. Have any of you done that? Yeah, that's scary. That's scary that you can take an entire trip and you didn't remember. Some of you have eaten and you get done and you're like, holy crap, I ate all that? I finished it? So we want to bring mindfulness to everything we're doing. So one way to bring mindfulness is to truly be present with what you're doing. Don't be on your cell phone and watching TV. Don't be eating and working. So that's one way. But the other way to do it is through meditation. And a lot of times meditation, it's not clearing your mind in any way and just sitting there and it's not this, crazy thing. It's a lot of breath work or a lot of focusing on different areas in your body so you can become present in your body. And what really helped me, there are 2 apps here. Insight Timer is one, they're free apps, Headspace, and it's going to walk you through like breath work or things to think about. But all meditation does is it increases that awareness and mindfulness so you don't have moments where you forget. But the other thing, it gets rid of those racing thoughts. How many of you have racing thoughts all the time where you're like, what do I have to do next? What do I have? Some people can't go to bed. I see you guys raising your hands. Some people, and that's you. And some people like you're in bed at night, like, oh yeah, I have to do this at night, I have to do this. Or you're driving and you're thinking of these thoughts, or all you're doing is creating emotions in your body, because most of the time those thoughts are hypothetical situations, right? Sometimes they're not even, it's like, you're like, what if this happens? You're hypothesizing. So meditation literally takes away those thoughts, takes it away. So try it and, let me know if you guys like it. So now I'm just going to quickly go through some acute care things. These are just minor things that, and I'm almost done. I know I'm going a little over time, so sorry guys. Regarding acute care, there are some things you can do not to prevent the headaches, but when you get them. And remember, if these things don't work, come in and get checked, because no matter how many oils you smear on yourself, no matter how much ice you do, supplementation, if you have that bone out of alignment, these things may not be effective. So when you've tried all of these, if you're still struggling, like I said, any of you who have guests you may know or family members, or any of you who aren't patients, let us know. We want to help you. We want to see if we can help. So these are just some oils if you guys want to jot them down. And what the essential oils are doing in this case, in the case of a migraine headache, all they're doing is enhancing the oxygen carrying capacity of oxygen into the cell. So they're opening up those blood vessels, allowing more room for the blood so it's not in there pulsating. And Anne, I see you writing some stuff down. We can send you some of these things too, just so you know. So next is cayenne pepper. So what you can do if you have a migraine headache in the moment, if you're brave enough, you can take straight up some cayenne pepper. And what that's going to do, and you want to take it with water, it doesn't matter if it's hot or cold. What that will do is release endorphins. When it hits the lining of your stomach, because it's so hot, it's going to release natural endorphins to help with the pain. So all these are just natural tools and tips I want to give you guys for if you do get a migraine. Next is this stuff called Easy Mag. And it basically, I talked about magnesium earlier, so it's going to relax the muscles, but this specific Easy Mag, you literally pour in water, these little packets, and right away it can instantly take a migraine away. And the reason is because it crosses the blood-brain barrier. That's basically a protection mechanism. And I'm not kidding you, I've used this before. I've had a migraine and I've drank some, and it instantly can help you. So next, this is the last thing I think I have on here for acute care is muscle release. I know some of you have been in and you've gotten adjusted by me, and I don't know if you've ever felt me push on these little muscles on the back of your head, and it's a little tender, it hurts a little bit, but these are our suboccipital muscles, basically at the base of my skull is where I'm pointing to. And if you guys like feel the base of your skull, the back of your head, and push in, you may be able to feel some tender spots, but those muscles get really tight. And when they do, they compress a nerve back there called the suboccipital nerve, producing a headache. So there are these things called fascial release balls. I have a picture, but you can also use a tennis ball or a lacrosse ball. If you use a tennis ball or lacrosse ball, you can put 2 in like the end of a sock. And what you'd want to do is essentially get on the floor, lay the ball right here in between your head on those tender spots and the ball, and allow just the weight of your head to lay back onto the ball. And it's basically going to release the muscle, and it can be really effective in just relieving some of the pain and pressure in the moment of a migraine, because sometimes you're just willing to do anything to get out of pain. So these are just some of the things that that can help. And lastly, this is also really effective. So if you take a ice pack and you put it on your head, base of your skull, or even if you had it surrounding your head, that would be okay too. You put the ice pack on your head, that's going to constrict the blood vessels in your head. And then you're going to put your hands and feet in hot water. And what that's going to do, the hot water is going to pull the blood away from your head. So helping take that pressure away. So you can submerge your whole body in the tub of water if you want, but mainly all you need are your hands and your feet in the hot water and an ice pack on your neck. So with that said, I wanted to tell you guys a secret. And, all that secret is that the same thing you would do for migraine headaches, you do for any condition. Any ailment in your body, whether it's high blood pressure, whether it's digestive issues, no matter what it is, you can look at it in these 3 realms: the physical, chemical, and emotional. And you can look at every aspect of your life and figure out what is causing that ailment. Is my high blood pressure being caused by the fact that I'm stressed out on my commute every day to work and my blood pressure is raising, and over time it's staying like that? Am I, getting migraine headaches because of I'm sleeping on my stomach every night? Because it's never just one thing. So look at your life in all aspects, no matter what the symptom is. The same thing you would do for a migraine, you would do for diabetes. The same thing you would do for a migraine, you would do for hip pain, look at all these areas of your life. And after you do all these things, after you address your life in this way, after you look at your diet, you look at your stress levels, you look at the amount of sleep you're getting, are you getting the right water intake? Do you have any deficiencies? Again, we can help you guys with all of these things. For those of you who are patients, let us know if you want us to hone in on any of these. But once you've tried all of these things, if you still have migraine headaches, let us know. Get in, get checked. See if it's a bone out of alignment. I hope these other things help you, because I want you guys to get help at home. But if or when they don't, come in and get checked. So with that said, if you're still here, I think you probably thought this presentation was valuable. Is that correct? Would you guys say you learned something tonight? At least one thing? Did you guys learn one thing? Oh, I see a little baby. Hi, Maria. Good. I hope you guys learned something, and I hope you think it's valuable. So would you agree that this will not be valuable if you don't act upon it? If you don't do any of these, if you don't look at any of these, would you agree? I see some thumbs up. Thank you guys for participating. I'm getting messages too. So it's awesome that you guys are participating. So what I want you guys to do, I truly want you to assess all these areas of your life. I want you to look at your diet. I want you to look at the products you're using. See if you're using natural products. Your health is your greatest investment. So I hear oftentimes, I don't want to spend money on organic food. I don't want to, get this supplement. I don't want to do this. But guess what? If you don't have your health, you don't have anything. Okay. You can't spend all that money in the first place. You can't be with the people you love. You can't do the things you want to do. Anne, did you have a question? You have to unmute yourself.
Yeah, I do have a question, but I don't know how much time you have. I didn't want to take away from your program.
Stay on at the end and I'll stay on with you. Does that work?
It's a question. I don't know how many people in the group, maybe other people have the same problem, but I had coronavirus back in June of last year.
Okay.
And before that, Dr. Rashidian had gotten my migraines under control with, like you said, the neck adjustments. And I had done that whole analysis and everything, and they were pretty much under control. I was only getting them once every 2 months. And then after the coronavirus, I just get them all the time. And I had to take steroids recently to get them to stop. And Dr. Rashidian he's working with me to work on it. So I don't want you to think I'm suffering, but I've had much more, I'd say several times a month I've had migraines.
Wow. Yeah. We may need to change something in your protocol, but
I don't think it's a protocol. My neurologist thinks it's lingering symptoms from the coronavirus.
Well, another thing I've seen with people recently, and I see this all the time when people have something that's making them cough a lot, it knocks things out of place. So I see people all the time who have mid-back pain after having, the flu or whatever. So a lot, and I've seen this with some patients with coronavirus, because you're coughing, you're breathing differently. So what it can do, it could have shifted things in your spine. And so we just need to get you back on track.
Thanks. Thank you.
Thank you for sharing. Okay. So what I want you to do, like I said, I want you guys to evaluate all areas of your life. And if you've done that and everything seems to be okay, and you're still having those migraine headaches and you're already a patient, then ask us to dig in deep with you guys and we'll try to figure it out. If you're not a patient, what I want you guys to do is come in and get checked. Stop letting the migraines interfere with your life. So I know we had added a few people, we lost a few people. So just in case anyone wasn't here, the gift that I'd offered to everyone on this call was a chance to come into our office and get checked and see if we can help you with your migraine headaches in any way. And what that offer includes is a consultation, an exam, a full set of x-rays, a full set of scans. And like I said, it's completely complimentary. And that's my gift. That's because I truly want to see if I can help, because I know how debilitating these things are. And like I told you guys earlier, to take it a step further, if you truly have someone that you care about and you want them to get checked, or you think they want to get checked, because you may have to ask them first, let them ask them, but also let us know. Give us your name and email and say interested in getting someone in, or give us their name and email, whatever it is. We'll get this presentation to them. They can listen to it, and we'll give them a week. Okay. And I have to put a time limit on it, because this is a big deal. This is a big gift, you know, giving a completely complimentary x-rays exam. So that's why I want you, if you know people, take advantage of it. Can be at either office, doesn't have to be the South office that I'm at. It can be any office, but message Market Square under participants and let them know if you want to take advantage of that. Because I want everyone to feel good. You know, we should all be able to live our life doing the things we want to do, hanging out with the people that we love, being a good mom. Carla, my guess is if you had a migraine, you can't take care of your kids the way you want to, right? And any of you who've had a migraine, it's probably stopped you from doing fun things, from doing stuff that you want to do. I know for me it did. So I don't want that to be you guys anymore. So like I said, because you guys joined me tonight, because you guys participated, because I want to help you guys, I'm offering this gift. So let us know if you want to take advantage of that. So thank you guys so much for joining me. Is there any questions that I can answer? You know, the presentation, sorry for going over, I'm a talker, was a little long. Can I do anything else for you guys? Answer any questions? Oh, one last thing. I have a raffle winner. The raffle, to draw the name, actually, Sophie already drew the name and she walked it in pretty early to me. The raffle winner is Dina Alvarado.
Wow.
Oh my
The
God, that's me.
Hypervolt. Hi, Dina.
Hi.
So you win our Hypervolt.
Oh,
So
wow.
that's awesome. And everyone else, those of you who signed up, the first 10 people, I know we lost some people. What we are going to do, we're going to get a hold of you to give you the little migraine self-care kit. But Dina, you get the Hypervolt. Have you had this used on you before?
No.
Yeah.
The office? Okay, it feels really good.
Okay, maybe the doctor, but I don't see, you know.
Yeah, and you're a patient at the North office, right?
Yes.
Okay.
With Dr.
So
Roberto.
we should probably have this at your next visit.
Oh, wow.
Depending on when that is.
Monday.
If it's
It's
tomorrow, I'm not sure, but you said
No.
Monday, so we'll try to have it there for you. Okay.
Yeah, okay,
Thank
thank
you.
you.
All right. Congratulations and thank you for joining.
Thank you.
All right. Does anyone else have a question or anything I can do for you guys, or anything I can show you, or no? All right. Well, thank you everyone for joining, and have a good night.
Thank you. Have a good night.
Have a good night.
Bye-bye.
Thank you. Good night.
Bye-bye.
Thank you, Dr. Nicole. Really great.
Welcome. Thank you.
Wow.